Okay. So that is wonderful that you are understanding whatever I am saying. And I would be happy to clear your queries. So please come up with your queries. Okay, so if there are no queries, then I will move ahead and I will share the next sample test with you all. Okay, now what is really a very big horror for medical students is the writing test. As writing habit you leave. Once you leave your school or your college, then you leave the habit of writing anything. So now you have to come back to that habit. So in the writing test, the reading time is 5 minutes and the writing time is 40 minutes. So you get ample time. So here, as I have told you earlier, you are not supposed to write a paragraph or a letter. Here you are required, a paragraph or an essay. Here you are required to write a letter that is based on a certain medical situation. Like you can see here, the situation is also given. I will just scroll down. So here is your case. You have to read this case and then frame a letter based on it. Can anyone read it for me? Can you unmute yourself and read this case? Yes, Ishu, Manpreet. Anyone out of you? Okay, so it's fine. So this is the situation actually. So you have to assume that today is 10th February 2019. These are the patient details, name, then residence, then admission date, discharge date, everything is given. You are given all the information related to the patient. Now, what is your task and what are you going to do in this writing test is you have to use this information as case notes and you have to write a letter of discharge for Miss Georgine Ponsford, the resident community nurse at the community retirement home. So this letter will accompany Mr. Ramamurthy back to the retirement home upon his discharge. So the patient is Mr. Ramamurthy and you have to write a letter of discharge for him. And you are given all the information. And you have to use letter format means block format. You must have heard it in your school days. Block format or semi-block format. I hope you all have heard about it. Okay, that's wonderful. So I will show you the sample letter as well. Here comes our sample letter. This you can see. This is called the block format. So this is what happens in the writing section in OET test. Here you can see. So here you can see on the left hand side, it's the same margin. You have to write it neatly. You have to cover all the information. Salutation is there, subject line is there, address line is there. So we cover all these things that you need to practice in letter writing. So now I hope you all must have understood that IELTS is totally different and OET is totally different from IELTS. The preparation is different and the value is also different. That is a common thing now. If you clear a test in your specific profession, it would have a higher weightage. Okay, so this was the writing test that I have discussed with you all. Now we are left with speaking. Sample test I will share with you. So I have told you many things about the speaking test. But here I want to show you how the test appears once you enroll yourself for OET exam. So here you can see this is OET sample test. Yes, Vikas, you have to write this type of letter. This was a sample. You can get another situation. The letter I have shown you, this type of letter you need to write. You are given all the information. And now you have to frame the letter based on the information that is given to you. I hope it's clear, Vikas. Okay, so this one is the sample test you can see here. So the setting is home visit. This is the last skill sample test we are doing. So that is the speaking test. That is the most important one. So here you can see, here also you are given a certain sort of situation that you have to deal with. You have been a diabetic for a number of years and have managed your diabetes with diet and tablets. However, your doctor wants you to start having insulin injections and has asked the district nurse to visit you at home to teach you how to give yourself these injections. You don't really understand why you have to have insulin injections. So you are very nervous about all this procedure of injecting yourself. So now what is your task in this test? So your task is, when asked by the nurse, stress that you feel you have been managing your diabetes well and you don't want to commence actually these insulin injections, and ask if there is another option to control your diabetes. And when the nurse is explaining the entire procedure for giving the insulin injections, show that you are really anxious and worried about it, so they provide you with another option. So here you have to act as a patient, not as a nurse. Here the role changes, but the situation is same from medical field. So don't worry, you are already good in your profession and you are confident professionals. So just you need a right guidance, a right stair to climb, so that your journey becomes easy for you, easy and smooth. Because you don't make a right choice, then things are going to get different from you. Don't put yourself in a muddle. So you have to come forward with right people, and we are here to guide you and to provide you the best path to make your journey a really, really special one. So I have shown you all the sample papers also today. So any other doubts that are popping up in your minds, you can come up and you can discuss with me. But I want you all to enroll, to join hands with us. And I'm really waiting for next week when you all will be my regular students. Am I correct? Yes. Vikas, Ishu, Manpreet, Gitanjali joined just now. Gitanjali, can you unmute yourself? Hello, Gitanjali.
Hello, ma'am. Good evening.
Good evening. So you joined class a little bit late. So please come up
Yes,
with your brief introduction, Gitanjali.
ma'am. My name is Gitanjali. I'm from Himachal Pradesh.
Okay, nice to hear that. So you're
I
working
just
somewhere?
no, not yet.
Okay, okay. Okay, Gitanjali, welcome to the class. And I know you joined late, but you will get the recorded sessions once you complete filling the Google form. Okay? All of you will get the
Okay, ma'am.
recordings of this session. Like Vikas, you were asking me yesterday, can I attend one more session? So today is the last demo session. So you will get the recordings, Vikas, for this session. Okay? Hello? You're gonna get the recordings for today's session. Okay, someone has joined with iPhone, mobile name. Please rename yourself. Come on, rename yourself so that we may know who are you. We may have a brief introduction with you. iPhone. Please rename yourself. Okay. So I will proceed further. To make your journey really, really smooth and comfortable for you all, we can understand that you all are already working professionals. You are working or you are engaged in one or the other thing. So to make it easier for you, the OET classes, they are divided in two times. One is morning session and another is evening session. Morning, you can say around 11 to 1, and evening somewhere around 4 to 6. So you can enroll in whatever session you feel comfortable with. But before that, you have to fill the Google form. You have to make all the formalities, and then only you can go for the classes. Okay, can all of you turn on your cameras? Yeah, please turn on your cameras once, all of you. Hello, students. Please turn on your cameras. Yeah, you all are requested to turn on your cameras. Gitanjali, Ishu, Vikas, Manpreet, all four of you. Please come up with your camera, students, so we may see your faces. Okay, Vikas is already there. Thank you so much. What about other students? Please turn on your cameras. Other students, we are waiting for you. Okay, Issue is also there. Can I see Manpreet Kaur, please? Okay, wonderful, Manpreet. So I can, please keep your cameras turned on. Yeah, it's a request from Nurset. Please keep your cameras turned on. Okay, it's wonderful to see all these confident faces. Manpreet, your camera should be on. Don't hesitate. Medical professional people, they are really, really social. You have to socialize. You have to leave all this shyness behind and come up as confident individuals. So once you are really confident in facing this camera, that we will do in the online classes as well. Okay, so that's great. Okay, so we are here. Swan cameras are already on. So can you just speak a little bit about yourself, your dream one by one? Manpreet is already there. So Manpreet, you can talk first. And like who motivated you to take this decision? And how did you find NurseEd? And what is your experience till now? All of you. Manpreet, would you start it? Come on, you can do it. Unmute yourself. You are great. Because you can come up. I can see you today. You can speak. Yesterday you were telling me you are driving and something like that. Yes, Vikas will share. Then Ishu, please come up with your camera. Ishu Thakur. Yes, Ishu. Yes, Vikas, I'm, longing to hear from you all. Come on. In the classes, you all have to come up, unmute yourself. And you have to talk. To learn English, you need a lots and lots of communication in English language. It's very, very difficult for shy people to interact in English. Are you shy when you speak your mother tongue? No. So take English as your mother tongue only. Once you settle abroad, it will become your mother tongue. Yes, come on. That's the spirit. Okay, Vikas wants to say something. I can see. Yes. Your mic is not working, I guess, Vikas. Okay, any other one issue? Manpreet? Gitanjali, here you are. We haven't seen you, Gitanjali. Gitanjali has not. Yes, Vikas. Wonderful. You are audible. Gitanjali, I can see you as well. Okay,
Sorry
first,
for
it's fine. Gitanjali, please introduce yourself now in front of the camera. I want to see that confidence in you.
okay. My name is Gitanjali and I'm 22. I've just done my BSc nursing from Himachal Pradesh University and I am from Himachal Pradesh.
Great. It was nice to hear from you, Gitanjali. See, you look quite
Thank
confident. It is that hesitation you have that needs to be cleared. Great.
thank you, ma'am.
Yes. Okay, Vikas, you were saying something.
Ma'am, my teacher motivated me to do OET.
Your school teacher, you mean?
No, ma'am, my college teacher,
College
where I had done.
lecturer, right?
Yes, ma'am, sorry, lecturer,
Yes.
where I had done my BSc nursing. So
So,
that's why I'm here.
okay, maybe
They
she has.
suggested me
Okay, great.
for nursing.
Wonderful. So maybe she has seen a spark in you that yes, you have a desire, a wish, a will to learn and speak English. That's why she suggested you. And you are on the right platform. So did you fill the
Maybe.
yes, did you fill the Google form that is
Yes,
shared
ma'am.
with? Okay.
Yes, ma'am.
So you will get the recordings of all these sessions, and once we are done with all the formalities from coming week, we will start your classes.
Okay, ma'am.
I hope everything is already shared with you all.
Yeah, ma'am.
Okay.
I
So
want to know something.
yes.
Ma'am, is IELTS is mandatory with OET?
No, if you have cleared OET, then IELTS is not mandatory.
Okay. It
It's
is an
doing the
option.
same. It's doing the same job. What IELTS will do? It's doing it in a better way. You just
Okay.
need to clear OET. Even you can work in US, UK, Singapore, Dubai, all these countries, they accept OET only. That's why students, they are moving towards OET, leaving IELTS. IELTS is mainly for people who are not from medical profession, like for college faculties, lecturers, people like me, who is an educator. So people like you, medical professionals, OET is the best option. So don't worry, you have taken the right decision. You are on the right path. No one is misguiding you.
Okay, ma'am. Ma'am, OET is just for UK and US, not for Australia.
It's for Australia also. For Australia, Dubai, Singapore. It's for
Okay.
all these countries globally. I have told you yesterday. Just wait, I will show you that slide again. Give me a second. I have shown you, but I think you have forgotten it or something like that. I will share the slide with you and show you the countries that accept OET. So you have a wider scope. You can see here. It is trusted by hospitals and universities in UK, US, Ireland, Australia, New Zealand, Dubai, and Singapore as a proof of ability to communicate effectively. So it is accepted in all these countries. I hope you can see in the slide now, Vikas.
Yes, ma'am.
Okay, so all your doubts are clear now?
Yeah, ma'am.
Okay, great. Any other student has any question? you can come up and ask me, because then I'm going to hand over to Miss Kanika Dogra. The last few minutes, she will be taking the session. So if you have any doubts, any queries, they are popping up in your mind, you can come up and ask me. I would be happy to answer you all.
Ma'am, OET is only for medical professionals only.
Yes, it is for medical professionals. See, I've shown you the list here.
Okay.
For these 12 medical professionals, it is valid. Other professional people, they are supposed to clear IELTS. Okay, any other doubt?
No, ma'am.
Okay, that's great. So now I am going to hand over to Miss Kanika, and she will carry on the session further. Thank you so much. You all were wonderful students, and hope to see you all in my session from coming week. Till then, bye-bye. Take care.
Thank you, ma'am.
Thank you, ma'am.
Yeah, you're
Thank you,
welcome.
ma'am.
You're welcome.
Hello, everyone.
Hello, good evening, ma'am.
Good evening, ma'am.
Good evening, ma'am. Like very learnful and keenful for you to learn different things of your profession. So, is my voice yes, Gitanjali, Ishu, Manpreet, and Vikas. Am I audible to you?
Yes, ma'am. Yes,
Okay.
ma'am.
Okay, so your fees of like OET which has been disclosed with you, and you have the timing so that by Monday you can take your regular classes. And as ma'am has already discussed with you that there will be two duration for the classes, that will be Monday anything about what she has been facing through, what she has already faced in OET. She'll be like she'll be sharing her experience with you. She'll be motivating you. She'll be correcting you for the parts of all modules. And Miss like Dr. Anjali is already there with you, so that you can upgrade yourself for the skillful yourself, and you can continue the classes according to your timing by Monday. So I think all are ready to join the OET classes now. Do you have any doubts, any further doubts? If you have, you can just ask right now. Yeah, guys, do you have any doubt? Okay, so because the timings will be accordingly your shift, like if you are eligible for morning, you can take morning one, and if you want to take an evening session, so evening will be there. You can coordinate with your like nursing operations head, Miss Nandini. You can just message in the group at what timing, if the timing is suitable for you or not. Rather than this, the timing will be probably by 4 to 6 or by 5 to 7. This will be the timing in evening. And if I talk about in morning, so in morning there will be a session of like 11 to 1, or it could be 10 to 12. Okay, so any further doubts? Yeah, so the nursery will be eagerly waiting for the next batch of OET that has been starting by Monday. So hope you Okay.